Hello, I'm Dr. Jeff Gold, and I have the honor of serving as the president here at the University of Nebraska System. Welcome to another episode of Shaping the Future. Shaping the Future is where we talk with faculty, staff, students, alumni, and community members who are truly making a difference every day. Today our guest is Ms. Peggy Abels. Peggy is the Director of Health Science Programs at the University of Nebraska at Kearney. She runs the programs that connect UNK students with healthcare careers, such as the Kearney Health Opportunities Program, better known as KHOP, one of the cooperative programs between UNK and UNMC that aims to increase the number of healthcare professionals serving widely across rural Nebraska. We're excited to have Peggy on Shaping the Future today and to hear more about how she's creating a pathway to rural health careers for Nebraskans, for students, and mostly to serve the rural communities of our state. So Peggy, first, thank you so much for being with us today and traveling with us to our studios here on East Campus. Before we talk about rural health and before we talk about KHOP, which I know you're so passionate about, let's talk a little bit about your career. How did you get interested in rural health and how did you connect with the UNK community to make it so successful?
Well, I'm originally from rural Nebraska, a little town in northeast Nebraska called Ewing, and so the rural part of it has always been part of my passion, proud of where I'm from and what those communities represent.
Sure.
But as a student, I loved science, and I wanted a career where I could impact people and make a difference in the lives of others, so I really wanted to work with people in some capacity. So I was considering healthcare and education, and I've been very blessed to find a career that lets me do both. And so I'm a graduate of UNK, so I'm also a proud Loper. And so, yeah, it's a good combination of all the things.
Well, and you've been doing it so successfully. And so let's talk a little bit about the birth of the KHOP program and why that's really been so important.
So we have a long history of our students going to UNMC to become healthcare professionals, and in 2010 we were able to formalize that by starting the KHOP program. We started with just 6 students for the College of Medicine, and we've grown from there. This past year we brought in 72 new freshmen, so we now have 177 students in the program total. So it's been fun to watch it grow and to add other professions across UNMC. We now have 11 UNMC professions in the program. So the UNMC partners have been fantastic in helping us grow the program, and it's been a great opportunity for our students from rural Nebraska.
So medicine, dentistry, pharmacy, nursing?
Yes, nursing, allied health, all of the allied health professions, and then most recently public health.
So you must be really excited, as I am, about the explosion, or literally coming out of the ground as we speak, of the new health science education complex, what of course is going to be known as the Douglas Christensen Health Science Education Complex, which is just an incredible opportunity to honor Chancellor Christensen and to, again, really increase the scope of the programming.
We are really excited about it, and so are the students and families that we visit with. Our students, many of them are first generation, they're from small rural communities, and they are just really grateful for the opportunity to receive fantastic health careers education in central Nebraska. Most of them really want to give back to their communities, and so they want to work in a rural areas, so being able to kind of work close to where they train and just be able to make their homes and careers in central and western Nebraska is important to them. So it's really exciting for the state, it's really exciting for the students, and of course to UNK as well. It's generated a lot of excitement.
Well, when we talk about the 50-50 rule, I don't know if you've heard me talk about that or not, but that 50% of healthcare professionals will set down their roots within 50 miles of where they finish their education and training, and hence the importance of having programs, not just the early undergraduate programs, but the graduate and completion programs in rural parts of the state. And you've had some pretty good statistics since we opened the Phase 1 Health Science Education Complex. I remember that was, in 2015 when we cut the ribbon there. I remember I was with Doug Christensen, and we had a big celebratory event. And what's the track record been of retaining those students?
Sure. So it opened in 2015, as you mentioned, and we have 85% of those graduates from that facility so far practicing in rural Nebraska. So proof of concept, as
Proof
we
of
like to
concept.
say, it's working. And so we're really excited about the next phase and what medicine and pharmacy are going to add to that.
So let me ask you, if there are students out that are listening to this broadcast and have an interest in exploring this, either one of the KHOP programs, or just, they want to be an undergraduate student at UNK and explore a health career, how do they do that? Do they go to a website? Do they make a phone call, talk to their high school guidance counselor? What's the best way to do that?
Sure. So we recently, about 5 years ago, developed a new program that complements KHOP very nicely. It's called Health Science Explorers. And it is really designed for that purpose. It is really for students to learn about healthcare. Rural students know about things like becoming a doctor and becoming a nurse and physical therapy perhaps, but they really are not aware of the full array of healthcare professions that they could have a fantastic, rewarding career from. So the purpose of that program is to generate awareness. And so that program is on our website at UNK Health Sciences Explorers, and students can go and they'll see a whole complement of programs. One of the programs we're really excited about is our virtual career club. So we are able to meet students wherever they are across the state, and they can join us virtually to learn about healthcare careers.
Well, that's so important given the expansive rural aspects of the state of Nebraska, of our farming and ranching communities. You know, as I'm sure you know, having grown up in a rural community, and I've certainly learned over the last decade as I've crisscrossed the state, that if there's not health care, it's pretty tough to have a vibrant agricultural community, because stuff happens on farms and ranches. As a matter of fact, we've focused on that very area on several of our Rural Health Matters broadcasts, that farming and ranching are dangerous businesses, and that you need access to emergency health care, you need access to preventative health care, whether it's dusts, whether it's chemicals, whether it's, mostly tractor injuries. Those things add up, and if you don't have access to quality care, the whole system seems to fall apart.
Very true, and I've lived in a rural community and I've seen that, even the small urgent care clinics, when they close, the impact that has on the community is really detrimental. Driving 30 miles even for an ear infection, let alone a significant farm accident.
Right.
And those are high-paying, high-demand jobs that require skill that also bring a lot of benefit to the community. And so
Absolutely.
the sustainability of rural communities really does need good quality health care.
So it's a win-win-win
Yes, it is.
situation
Yes, it
for
is.
Nebraska, for the university, and most importantly for the rural communities that we serve. Well, Peggy, thank you so much for being with us today. It's a pleasure to talk to you. And thank you so much for being with us today on this special broadcast. And again, if you have questions, come to one of our websites or call us. We'd love to talk to you about how you can have a health career at UNK and become part of this important program.